Good morning. I'm going to read the endocrine system. Excess and deficiency. An excess, too much, or a deficiency, too little, of circulating hormones cause a wide range of medical conditions. For example, hypothyroidism or hypothyroidism, where there's where there is an excess of hormone. One form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be replacement therapy. For example, injections of insulin in the treatment of type 1 diabetes. Doctor says sufferers of type 1 diabetes are deficient in insulin. Negative feedback system. TRH is secreted in the hypothalamus and trigger the production of TSH in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 and T3, and also to release stored hormone, producing increased plasma levels of T4 and T3. T3 feedback on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. Goitry. An enlarged thyroid gland is called goitry. The enlarged may be diffuse, involving most of the gland, or localized, limited to a particular area, as in a solitary nodule. The increased blood flow in diffuse enlarged, for example, in Graves' disease. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Dear doctor, I would be grateful if you would see this 50 years old woman who has lost 20 kilos in weight. In spite of eating more than usual, she described herself as overactive, and at first she thought the weight loss may due to this. But more recently, she has developed palpitation, diarrhea, and heat tolerance. She has noticed that her hands had a tendency to shake. Now I'm going to read the exercise. Complete the table with words from A, B, and C opposite and related forms. Verb: inhibit, produce, release, replace, secreted, stimulate. Noun: inhibition, production, release, replacement, secretion, and stimulation. Complete the passage from a textbook using the illustration and your own knowledge. Pools of GnRH are released from the hypothalamus and stimulate LH and FSH secreted from the pituitary. LH stimulates testosterone secretion from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibits GnRH, stimulating FSH, stimulates the Sertoli cells in the seminiferous tubes to stimulate mature sperm, and then inhibins A and B. Inhibin cause feedback on the pituitary to decrease FSH inhibition. Complete the sentence. A generalized change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. Thyroxine T3 and T4 increase the basal metabolic rate. Much Mr. Davis symptoms. Diarrhea, it's going with the are you bowels normal? Eating more, with what is your patient appetite like? Heat intolerance, do you prefer hot weather or cold? Overactivity, are you able to sit and relax? Palpitation, have you ever felt your heart beating rapidly or irregularly? Weight loss, is your weight steady? And tremor, do your hands shake? Ahora voy a leer los ejercicios en español. Completa la tabla con las palabras de A, B y C en sus formas relativas. Verbo: inhibir, producir, liberar, reemplazar. Sustantivo: inhibición, producción, liberación y reemplazo. Está también secretar, secreción, estimular, estimulación. Completa el pasaje con las palabras faltantes. Las palabras faltantes, la primera es estimular, segunda secretada, la tercera estimula, secreción, retroalimenta, inhibe, estimulando, estimula, estimular e inhibición. Completa las oraciones. Un cambio generalizado afecta muchas partes de un órgano o glándula. Un cambio localizado afecta solo una parte. Su dieta es deficiente en hierro, no obtiene suficiente hierro. La tiroxina, T3 y T4 aumentan el metabolismo basal. Y parea los síntomas del señor David. La diarrea tiene diarrea normal, come más, ¿qué apetito tiene? Intolerancia al calor, prefiere el calor o el frío. Hiperactividad, puede sentarse y relajarse. Palpitaciones, ¿alguna vez has sentido que el corazón le late rápido o de forma irregular? Pérdida de peso, su peso se mantiene estable. Y temblor, ¿le tiemblan las manos? Es todo.